So I want to put aside a couple of questions that I have. You know, YouTube has many videos with hundreds of thousands of views on ED and its role. I'm sorry, and the healthcare practitioner's role in the treatment of it. Most of those are shot by doctors, and great. I certainly believe that doctors are equipped to treat ED, not only using medications, Shockwave, which is right behind me, but they're also now doing PRP. They have other surgical procedures they can do. But I wanted to talk about physical therapists. Physical therapists like me are poised and positioned to help with ED because we are kind of the specialists when it comes to musculoskeletal injuries. Now, most men don't really think about the penis and the areas around there as being musculoskeletal, but what I would like to show you for just a brief moment is you've got all these muscles. You've got muscles in what's called the pelvic floor. Women know a lot about the pelvic floor because they have issues postpartum that can arise, whether it's in leakage or in other issues that arise in their pelvic floor. But men, we don't really know much about it. But physical therapists like me are very positioned to understand what the role of musculature is in and around the areas of the pelvic floor. And so I say that because it's easy sometimes to think you can just go get treatment, get Shockwave, go on medicine, get a PRP injection. But I will tell you, physical therapists teach you how to engage your pelvic floor muscles. Sometimes you want to disengage your pelvic floor muscles. If you have a lot of tension, that can also be part of the problem when it comes to erectile dysfunction. And so I would ask you, those of you that are watching, to understand that there's hope. There are options. Yes, you can go to your doctor. Physical therapists like me who are proficient in understanding the pelvic floor, have worked on the pelvic floor with both men and women. You want to seek out specialists that do that, because it's not just about doing, it's not just about doing shockwave therapy, which is what this is. It's also about doing the proper exercises, the proper stretching, the proper breathing. It's a little bit more inclusive. I'm happy to have those conversations with you, but I often get asked questions via messages, and that's not really the most effective way to be able to respond. It's not the best use of my time. You can always call the office at 484-582-0660, and I can set up some time to talk about the details with you. So I know this is a little bit of a longer message, but I thought it was important that you understand physical therapists really understand this area. We're poised to help. Hope that helps. Thanks.